Hi everybody, this is Venk with Always On EM. As you know, I'm in Vegas at ACEP and at the Research Forum. I bumped into Matt here. I'm really excited to learn more about your research. Matt, tell us a little bit about yourself and your project.
Sure. Hey everybody. I'm Matt Kostura. I work in Cleveland, Ohio with the Cleveland Clinic, and I'm one of the assistant program directors with the Case Western Reserve University Metro Health Medical Center Cleveland Clinic Emergency Medicine Residency Program. So doing an educational poster here. It's about a simulation event we did of a combined sim of high acuity, low occurrence obstetric emergencies. It was really cool. The Cleveland Clinic were all about interdisciplinary education, and it was a good opportunity to work with some of the sim folks on the OB side. So we had some of our senior residents work with those OB residents to do some combined obstetric emergency simulations. So we basically, our objectives were to use the safety of the sim environment to see how we handle some rare emergencies that we might see in the ED, where we got to call that team down. We developed 3 cases. One was a tricyclic antidepressant overdose. We had a postpartum cardiomyopathy, and then we had the trauma, OB trauma gunshot wound.
You're talking about resuscitative hysterotomy?
Exactly,
Yeah.
exactly.
Great.
So that rare stuff that we all are nervous to do, but got to be ready to do when it comes. So it was pretty cool. We did before and after surveys to assess how the learners liked the simulations, what they got out of it, and the results are shown here. We had 33 residents do the pre-survey, 25 do the post, and 22 who did both. So we took out the incomplete surveys. We had to do kind of pre and post basically to do our analysis.
Yeah.
And pretty much in everything we asked them, they saw improvements where they got learning, and we just highlighted some of those results here. So increased confidence and ability to perform that resuscitative C-section, the postmortem C-section. They saw an increased confidence overall in responding to obstetric emergencies. And then 86% of the respondents, so the vast majority of our residents, both OB and emergency medicine, really agreed that this multidisciplinary simulation was a good way to kind of learn how to handle these emergencies. So, we think this high fidelity sim is a great way to teach these residents, kind of teamwork in this situation. I'll just say personally, it was really cool to do the debrief with the residents, and you really saw on both sides them appreciating the other specialty. The OBs, hey, how did you get that overdose? Us, hey, thanks for coaching us through that perimortem C-section, getting the tips and pearls. So it was really fun to do, and we hope to do more of these things in the future.
That's really cool. I don't think I've heard about doing interprofessional or interspecialty high fidelity sims on this before, and I could see that being the benefit. Did you have a systematic approach to that debrief? How do you do that?
We do some of the sim-based education debrief. Start off with everybody's kind of thoughts, feelings. Explain the facts of the case, and then kind of go through it to make sure they got the medical knowledge they did, and then kind of an open discussion of what they all learned from each other. Going back and forth from both sides. So
this is really cool, Matt. Thank you so much for sharing it. Good luck with everything, and I hope you have a great time here in Vegas.
Yeah, thanks so much.